Hello and welcome to Diabetes Connections in the News. I'm Stacey Sims, and these are the top diabetes stories and headlines of the past 7 days. In the News is brought to you by T1D Exchange. The T1D Exchange is a nonprofit organization dedicated to improving outcomes for the entire T1D population. And by my new book, Still the World's Worst, Diabetes Mom, More Real-Life Stories of Parenting a Child with Type 1 Diabetes, available at Amazon, Target, and Barnes & Noble, wherever you get your books online. Our top story this week, the first automated insulin delivery system using the Freestyle Libre 3 is now authorized in Germany. The MyLife Yipso pump, the Freestyle Libre 3, are combined with the MyLife CAM APS FX algorithm from CAM Diab. Yipsum had already launched MyLife Loop in partnership with CAM Diab in early summer 2022 in several countries, but that was with the Dexcom G6. The company now says by enabling the Freestyle Libre 3 sensor to work with MyLife Loop, people with diabetes now have the option of choosing between the two sensors and of customizing their loop. Again, only in Germany right now, other European countries to follow next year. This is currently available for Android, and they say iOS will follow in the second half of 2023. I spoke with the folks from Yipsomed for the podcast last year. I'll link that episode up. They are partnering with Lilly and plan to bring their pump to the U.S. Right now, though, here, only the Dexcom G6 is approved for AID use, so we'll have to wait and see if we get this same kind of, dare I say, interoperability. Really interesting, but very early work on a protein known as BEFA. It's produced by gut bacteria and triggers the division of cells that make insulin. Researchers at the University of Utah are working on understanding more about how BEFA works, hoping it could help them figure out a way to stimulate beta cell production. Recently published in the journal Cell Metabolism, the findings suggest bacterial warfare in the gut can have collateral beneficial effects on the body, boosting the population of cells that can make insulin throughout our lives. The team here imagines possible applications like proactively fortifying the microbiomes of high-risk babies with BEFA-producing bacteria that could prevent them from later developing type 1 diabetes. A new serological test may be pivotal in the search for viral triggers of diseases like diabetes and celiac disease. PepSec is a technology that allows scientists to test antibody binding against hundreds of thousands of protein targets at one time. Right now, they are tested one at a time. It's said to be an important step forward as concerns about bioterrorism and the next pandemic are not far away. Understanding these pathogens, they say, will help scientists develop vaccines and track their movement and evolution. These researchers say what is basically a blood test here is also really important in the search for potential viral triggers for non-infectious diseases like diabetes and celiac. We told you about the recent approval of Teplizumab. The brand name is now Tzield by the U.S. FDA. This is the drug that is shown to delay a diagnosis of type 1 diabetes. We're learning more about it now, and it is administered by intravenous infusion once daily for 14 consecutive days. It's expected to cost close to $200,000 for the course of the treatment. Now, that's according to an investor call from Provention Bio, that's the company that makes this, the chief commercial officer, Jason Hoyt. He also said that among the company's strategic initiatives were advancing awareness and screening for autoantibodies and ultimately routine screening during pediatric well visits for the general population. A lot of questions here. I'm hoping to have Provention back on the show soon. They do say without broad population-based screening, first-degree relatives of those with type 1 are likely to be the first to be screened. A new way to test for pancreatic cancer is being considered a breakthrough. Pancreatic cancer is commonly considered the deadliest of all cancers, in part because with few symptoms and invasive testing, it's so difficult to detect. Blue Star Genomics has developed a new non-invasive liquid biopsy test. It uses a blood test. Pancreatic cancer is 8 times as common in patients over the age of 50 with a recent diagnosis of type 2. Sometimes new cases of type 2 may actually be a consequence of early undetected pancreatic cancer. Blue Star has breakthrough designation from the FDA. It is too soon for doctors to recommend this for everybody with type 2, but those recently diagnosed may want to ask their doctors. Not really news, but a lot of social media chatter about a lame diabetes joke, this time during Wednesday, the reboot of The Addams Family on Netflix. Hearing great things about the show, but not the diabetes joke. Good time to mention Diatribe's Destigmatize campaign. I will link up the website. It's an effort to collect stories and to come up with action to fight diabetes stigma. Back to the news in just a moment, but first, Diabetes Connections in the News is brought to you by the T1D Exchange Registry. And you know this is a research study. They've been doing this for a while, and it really gets results. The platform is open to kids and adults with T1D living in the U.S. Your participation is fully voluntary, and your personal information remains confidential. The questions they ask really matter in a way that polls on social media, they kind of go out there, right? You answer a question or poll on Facebook, and then either nothing is done with it or you don't know what's going on with it. But the T1D Exchange, right now, if you go to their website, they're talking about using glucagon. Embarrassing and frustrating is the headline. And when you dive deeper, you can see who took this poll, what they used for their emergency glucagon. Do they have it when they need it? And T1D Exchange uses that evidence to support policy or insurance changes that can help the T1D community. Like I said, it really matters. And you can help the T1D Exchange Registry reach their 2020 goal. They need about 1,000 more people to fill out their annual questionnaire by the end of the year. For more information on that or to register for the first time, just go to t1dregistry.org/Stacey. That is t1dregistry.org/STACEY. Big shout out to friend of the show and friend of mine, Mike Hoskins. Mike wrote for Diabetes Mind for many years, and he still works at their parent company, Healthline. He recently shared a lot of information and feelings about his diagnosis of diabetic retinopathy. He goes into detail of what the treatment has been like, and he says that others who shared that information with him helped make it all a bit easier, so he wanted to kind of pay it forward. It's a wonderful and incredibly informative article, and I will link it up in the show notes. Thanks for doing that, Mike, and I hope you're doing well. Many of you have probably been following Jordan Morris for many years, but just in case, the 28-year-old professional soccer player was diagnosed with type 1 at age 9, and he is now part of the U.S. men's national team that beat Iran this week and moves ahead to the World Cup knockout rounds this weekend. Morris plays out of Seattle. He started a foundation a long time ago, the Jordan Morris Foundation, to support kids living with type 1 diabetes. All right, on the podcast next week, we're talking to OneDrop. It's been a while since we've spoken to these folks. They started a company back in 2014 to make an easier to use and a sleeker looking meter. And since then, they've added things like telehealth and one-on-one, I don't want to call it coaching, personal help, medical professionals, and they've expanded into different devices. But what we wanted to talk to them about is the CGM that they are developing. So OneDrop's CGM on the show next week. This past week was with psychotherapist Joanne Robb, who spoke not only about holiday eating and the stress that comes this year, but if you listened, she did like a little personal session for me and my stress about sending Penny off to college. It was a really soothing show for me. I know it's kind of weird to say that, but man, she was very calming. I like talking to Joanne a lot. And that was last week's show. You can listen wherever you get your podcasts, wherever you're listening to this one. And that is in the news for this week. If you like it, please share it with somebody else. And thank you so much for joining me. I'm Stacey Sims. I'll see you back here soon.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.